students are forced to choose between sacrificing their health to stay enrolled or sacrificing their education to stay well in Australia.
I learned that young people don't disengage from education because they don't care. They disengage because their material basics are not being met.
Healthcare shouldn't depend on your postcode. Young people in regional communities deserve the same access to healthcare, support and stability as those living in metropolitan areas.
This conversation is not new. You have all heard it before, at events just like this, in rooms similar to this one. Every year another youth representative stands up here and asks, no, as a matter of fact, demands the same change I am asking for today.
Today's summit is so important because it puts the voices of children and young people right at the centre. We've heard from some amazing young people today who are demanding our attention and who provide us not just with lived experience but real expertise and knowledge that should be taken into consideration in policy development and decision making moving forward.
And one thing has become very clear to me. When young people are meaningfully included in conversations about change, systems become stronger. Because the people who have lived through the challenges often most understand the solutions most clearly.
We understand the statistics. We have reviewed the reports. We know the workforce shortages and we know the funding gaps. But while the system is reviewed again and again and again and again and again, rural families will continue to absorb the invisible costs. So I can't help but ask those in power, when will we stop reviewing and start fixing?